Have you ever had a tiny cut, a piercing, or maybe even just a pimple that healed, but then the scar just kept on growing? Well, that's what we're talking about today. We're diving deep into keloids, a skin condition that's pretty common but also really misunderstood, where the body's healing process basically forgets to hit the brakes. Just imagine being 18 years old. You finally get through a rough patch of acne and you think you're in the clear. But then a scar shows up, and as this patient said, it's just been slowly growing for more than 1 year. I mean, that really gets to the heart of what's so frustrating about a keloid. It just doesn't stop. So what in the world is actually going on under the skin? To really get what a keloid is, we first got to talk about what it's not. See, when you get a cut, your body is brilliant at healing it. But for some folks, it's like a switch gets flipped, and the whole healing process just goes haywire. So what's the real difference here? Okay, so at its core, a keloid is what doctors call a fibroproliferative disorder. Whoa, that's a mouthful, right? But all it really means is that the skin's healing engine gets stuck in overdrive. So instead of just building enough new tissue to close the wound, it just keeps pumping out way too much collagen, and it never ever gets the signal to stop, chill out, and fade away. Think of it like this. A normal scar is a polite house guest. It shows up, does its job healing the wound, and then it stays put, right inside the original injury. A keloid, on the other hand, it's like an invader. It doesn't care about boundaries. It grows way beyond the original cut, creating this raised, often shiny scar that just refuses to fade on its own. And this timeline here, this makes it all crystal clear. Normal scars, and even those more raised ones called hypertrophic scars, they all eventually hit this final phase called involution. That's just a fancy word for shrinking and maturing. But keloids, they get stuck. They grow, they stabilize, and then nothing. They never get the memo to start shrinking. The whole process is just frozen in this state of nonstop growth. So, the big question is, why do some people get these runaway scars while other people don't? Well, as it turns out, your genes and some very specific triggers play a huge role. And keloids are way more common than you might think. We're talking up to 16% of people in certain populations. So this isn't some rare, bizarre condition. It's a major dermatological issue for millions and millions of people all over the world. The risk factors are actually surprisingly specific. There is a strong genetic link, so if keloids run in your family, yeah, your risk is definitely higher. They're also much more common in people with darker skin tones, and they tend to pop up most often between the ages of 10 and 30, right around puberty and when your hormones are going wild. And what actually kicks this whole process off, A lot of the time, it's something incredibly minor. We're talking about acne, an ear piercing, a tattoo. Even a simple little bug bite can be the trigger in someone who's susceptible. The injury itself doesn't have to be big at all to start this whole abnormal healing cascade. So here's the bottom line. For someone with that predisposition, any tiny injury can send a signal to their skin to start making collagen. But with a keloid, that signal just never ever turns off. It leads to this massive, excessive pileup of scar tissue. Now, given how they look, you might be worried that figuring out if you have one involves a bunch of complicated, scary tests. But the good news is, it's usually really straightforward. Yeah, almost all of the time, an experienced doctor can diagnose a keloid just by looking at it and asking a few simple questions. It really is a diagnosis based on pattern recognition, what the scar looks like, where it is on the body, and how it's been behaving over time. A doctor is basically looking for a classic combo of clues. Was there some kind of known trauma, like a piercing? Check. Has the scar been growing slowly but surely? Check. And the big one, does it spill out way beyond the borders of the original wound? If it's checking all these boxes, especially if it's on a common spot like the chest or earlobes, the diagnosis is usually a slam dunk. Now, here is a really critical and kind of wild point. You'd think a biopsy, taking a little sample of the tissue, would be the best way to be 100% certain, right? But with keloids, cutting into the skin is a trigger. The very act of taking a sample can cause an even bigger, angrier keloid to form right in its place. And that's exactly why doctors avoid it unless they're really unsure about the diagnosis. All right, so what can you actually do about them? This is often the toughest part of the whole journey for patients, because there's just no single, easy, one-size-fits-all cure for keloids. The medical literature is actually refreshingly honest about this challenge. As one source puts it, treatment is a matter of trial and error with no predictable outcome. I think that's so important because it sets a realistic expectation right away. Managing keloids is a process. It's about finding what works for you, and it takes a lot of patience from both the patient and the doctor. So, to make sense of all the options, doctors usually follow a tiered approach. They start with the least invasive stuff, then they move to more intense combinations if those don't work, and they're always keeping an eye on new treatments coming down the pike. So, what's on that first tier? Well, it's all about trying to manage the scar without any major procedures. Things like silicone sheets can help flatten the scar over many months. Corticosteroid injections right into the keloid are super common. They work by dialing down inflammation and breaking up that excess collagen. Then you've got things like pressure therapy and even cryotherapy, freezing it. All tools in the toolbox aimed at trying to convince that scar to finally shrink. But what happens when those things just don't get the job done? A lot of people naturally think, well, why not just cut the thing off? And surgery is definitely an option, but it's an option that comes with a massive flashing warning sign. And this right here is the absolute key. If you remember one thing from this whole explainer, let it be this. Just cutting out a keloid without any follow-up treatment is almost guaranteed to fail. The new surgical wound is a huge trauma to the skin, and it can trigger a brand new keloid that is even bigger and more aggressive than the one you started with. Seriously, can you imagine the frustration? This is the most important warning about surgery. So, how in the world do you make surgery successful? Well, it has to be immediately followed by what are called adjuvant therapies. These are treatments specifically designed to stop that healing process from going into overdrive again. This could mean radiation therapy right after surgery, a series of steroid injections, or keeping sustained pressure on the area. It's the combination, the 1-2 punch, that's the real key to stopping it from coming back. Which, of course, brings us to our final and maybe our most important section. Because treatment is so darn challenging, the absolute best strategy for anyone who's at risk is, without a doubt, prevention. If you know you're prone to keloids, knowledge is absolutely your superpower. It means being extra cautious about any procedure that breaks the skin. Maybe you reconsider that tattoo or piercing, you avoid elective surgeries, and you make sure you tell any doctor or surgeon about your history before they do anything. Even just treating acne quickly and effectively can prevent those initial triggers from ever happening. In the end, keloids are this complex puzzle where genetics, skin trauma, and a rogue healing process all collide. And while there's no perfect cure yet, the real path forward seems to lie in a partnership, combining preventative awareness from patients with a super careful, multi-step treatment approach from doctors. It's about managing, not just removing. And that collaboration is everything.